Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a GP talking to a patient called Thompson. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Thompson. How are you today?
Morning, Doctor. I'm all right, but something's been bothering me, so I thought I should get it checked out.
I see. What seems to be the issue?
Well, for the past couple of weeks, I've been feeling really tired. Like, more than usual. It's not the normal kind of tired, it feels deeper, like my whole body's drained. And I've had this weird rash on my leg. It started as a small red spot but then grew into this larger circular shape. A friend of mine said it looked like a bullseye, so I figured I'd better see someone about it.
That's interesting. You said it started a few weeks ago. Can you remember anything that happened around that time? Any outdoor activities or insect bites?
Actually, yeah. I went camping with some friends about 3 weeks ago. We were hiking and spent a lot of time in the woods. I did get bitten by something, but I didn't think much of it at the time. It just looked like a mosquito bite at first.
Okay, that's helpful to know. Based on what you've told me, especially the fatigue, the rash, and the bite, there's a possibility this could be related to Lyme disease. Have you heard of that before?
Yeah, I've heard of it, but I don't really know much about it. Isn't it caused by ticks?
Yes, that's correct. Lyme disease is transmitted through the bite of infected black-legged ticks, also known as deer ticks. Not everyone who gets bitten by a tick develops Lyme disease, but if the tick carries the bacteria, it can cause an infection. The symptoms you've described, the bullseye rash and the fatigue, are classic signs. Have you had any other symptoms like headaches, joint pain, or a fever?
Now that you mention it, I have had some muscle aches. At first, I thought it was just from the hiking, but they haven't gone away. No fever, though.
Muscle aches are another common symptom. It's good that you came in when you did because early detection is key. If Lyme disease is left untreated, it can lead to more serious complications, affecting your joints, heart, and even your nervous system.
That sounds serious. What should I do now?
First, I'd like to run some tests to confirm if it's Lyme disease. We can do a blood test to check for antibodies to the bacteria. If the test comes back positive, we'll start you on a course of antibiotics, which is the standard treatment. The sooner we start, the better the outcome. Antibiotics are typically very effective, especially in the early stages.
How long does the treatment take?
Usually the course lasts for about 2 to 4 weeks. Most people start to feel better after a few days of treatment, but it's important to finish the full course to make sure the infection is completely cleared.
Is there anything I should do in the meantime?
Rest is important, especially since fatigue is one of your main symptoms. Try to avoid strenuous activities for now. I also recommend staying hydrated and eating well to support your recovery. And keep an eye on the rash. If it changes or if you develop any new symptoms, let me know right away.
Will the rash go away on its own?
Yes, it should fade as the antibiotics start to work. The rash is a reaction to the infection, So as we treat the underlying cause, it will improve. If the rash becomes more painful, or if you notice any spreading though, don't hesitate to reach out.
That makes sense. What about preventing this in the future? Should I be worried about going outdoors again?
You don't need to avoid outdoor activities entirely, but it's a good idea to take precautions, especially if you're in areas where ticks are common. Wearing long sleeves, tucking your pants into your socks, and using insect repellent with DEET can help prevent tick bites. Also, checking your body for ticks after being outside is important. They're tiny, but they can attach to your skin, so a full body check is always a good habit.
I'll definitely be more careful next time. How likely is it to get Lyme disease again?
It's possible to get Lyme disease more than once if you're bitten by another infected tick, but if you're aware of the risks and take the right precautions, you can reduce your chances significantly.
That's good to know. I'm glad I came in. I didn't think much of it at first, but now I realize it could have gotten a lot worse.
Yes, it's always better to err on the side of caution when it comes to something like this. We'll get those tests done today and move forward from there. You should expect results within a few days, and I'll contact you as soon as they're in.
Sounds good. Thanks, Doctor.
You're welcome, Mr. Thompson. Take care, and I'll be in touch soon.
Extract 2, questions 13 to 24. You hear a doctor talking to a patient called John Parker about the potential diagnosis of Castleman disease. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes. Good afternoon, Mr. Parker. Your GP referred you to me because your recent tests indicated something unusual. We are looking at a possible diagnosis of Castleman disease. How are you feeling about everything so far?
To be honest, doctor, I'm really confused. I've never heard of Castleman disease before, and I don't even know what it means. When the GP mentioned it, I didn't know what to think. I've just been feeling tired and unwell for months, and now this.
I understand, Mr. Parker. Castleman disease is indeed a rare condition, so it's completely normal to feel uncertain. It's a type of lymphoproliferative disorder, which means it involves an overgrowth of cells in your lymph nodes. Let's go over your symptoms and discuss what's been happening with your health recently.
Sure. It all started a few months ago when I noticed these lumps in my neck and armpits. At first I thought they were just swollen glands from a cold or something, but they didn't go away. Then I started feeling really run down, with night sweats and losing weight without trying. I've had this constant low-grade fever too. That's when I decided to see my GP.
Those symptoms are consistent with what we see in Castleman disease, especially the enlarged lymph nodes, fever, and unintentional weight loss. Did your GP mention anything about the type of Castleman disease you might have? There are a few different forms, and the treatment can vary depending on which one it is.
He did mention there were different types, but he wasn't sure which one I have. He said something about needing more tests to figure it out. That's why I'm here, right?
Exactly. There are two main types, unicentric and multicentric. Unicentric Castleman disease affects only one lymph node or region of lymph nodes, while multicentric Castleman disease affects multiple lymph nodes and can involve other organs. The symptoms you've described lean more towards the multicentric type, but we'll need to do a biopsy and more blood tests to confirm.
That sounds serious. What's the difference in terms of treatment? Is it something that can be cured, or am I looking at long-term treatment?
If it turns out to be unicentric Castleman disease, surgery to remove the affected lymph node is often curative. For multicentric Castleman disease, the treatment is more complex. It usually involves medications to control the disease, like corticosteroids, immunosuppressants, or targeted therapies that block certain proteins involved in the disease process. Unfortunately, multicentric Castleman disease can be chronic and requires ongoing management.
I see. So if it's the multicentric type, it's more about managing the disease than curing it?
That's correct. But the good news is that with the right treatment plan, many patients can manage their symptoms and maintain a good quality of life. The treatment we choose will depend on your specific case, including how advanced the disease is and how your body responds to the medications.
I guess I'm just worried about what this means for my future. I've got a family, and I need to be there for them. How serious is this really?
It's understandable to be concerned, Mr. Parker. Castleman disease can be serious, especially the multicentric form, but the prognosis varies widely depending on many factors. Early diagnosis and treatment are key to managing the disease effectively. Some patients respond very well to treatment and can live relatively normal lives, while others may need more intensive therapy. We'll tailor the treatment to your needs and monitor your progress closely.
I appreciate you explaining this, doctor. It's just a lot to take in. What can I do on my end to help with the treatment?
Staying informed and involved in your care is a great start. We'll go over all your options in detail once we have more information from the additional tests. It's also important to take care of your overall health, eating well, staying active when possible, and managing stress can all help. And of course, keeping regular follow-up appointments will allow us to catch any changes in your condition early.
I'll do my best. I just want to make sure I'm doing everything I can. How soon will we know more?
We should have the biopsy results and other test information within the next couple of weeks. Once we have a clearer picture, we can discuss the next steps. In the meantime, if you experience any new symptoms or feel worse, please don't hesitate to contact me right away.
I will, doctor. Thank you for taking the time to explain everything. It helps to know what's going on, even if it's a bit scary.
You're welcome, Mr. Parker. It's natural to feel that way, but remember, you're not alone in this. We are here to help you through every step. We'll work together to manage this condition and keep you as healthy as possible. Take care, and I'll see you soon.
Thanks again, doctor. I appreciate your support.
Anytime. We'll be in touch as soon as we have more information. That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a medical professional explaining a septic technique. Now read the question.
In a healthcare setting, mastering the aseptic technique is vital to preventing infections during medical procedures. Aseptic technique encompasses a range of practices designed to minimize contamination by pathogens. These practices include sterilizing equipment, disinfecting surfaces, and maintaining a sterile environment throughout the procedure. For instance, when inserting a catheter, it's essential to clean the area around the insertion site thoroughly and use sterile gloves to prevent introducing bacteria into the body. Additionally, during surgery, Maintaining a sterile field is critical, ensuring that all instruments, drapes, and surfaces that come into contact with the patient are free from contaminants. Proper hand hygiene is another crucial component of aseptic technique, as it reduces the risk of transferring microorganisms. The use of personal protective equipment, PPE, such as sterile gloves, gowns, and masks, further aids in maintaining sterility. By understanding and consistently applying aseptic techniques, healthcare professionals can significantly reduce the risk of healthcare-associated infections, thereby safeguarding patient safety and improving overall care quality.
Now look at question 26. You hear a nurse and a patient discussing post-surgery care. Now read the question.
Yes, but make sure the water is lukewarm and you pat the area dry. After cleaning, what comes next?
I need to apply the antibiotic ointment you prescribed.
Correct. And remember, you should use a clean cotton swab to avoid infection. How often should you change the dressing?
Twice a day, once in the morning and once in the evening.
That's right. Also, it's important to avoid any heavy lifting or strenuous activity. Why is that?
To prevent reopening the incision or causing any complications.
Exactly. And if you notice any unusual redness, swelling, or discharge, what should you do?
Contact the clinic immediately.
Now look at question 27. You hear two healthcare professionals discussing a patient's treatment plan. Now read the question.
Hi, Maria. How are you? Can I run something by you quickly?
Sure, Dr. Collins. What's up?
Have you gone over Mr. Thompson's latest treatment plan? He's been prescribed a new medication, and I'm concerned about the dosage.
Yes, I reviewed it earlier. The dosage seems a bit high for someone with his medical history, doesn't it?
Exactly. I called the pharmacy to double-check, and they confirmed it's the correct dosage, but I still think we should be cautious.
Did you reach out to Dr. Patel yet? She's the one who has been managing his case from the beginning.
Not yet, I was thinking about doing that. But I wanted to get your input first.
I definitely recommend consulting with her before making any decisions. She might have a different perspective on the treatment.
You're right. I'll talk to her now.
Now look at question 28. You hear two hospital administrators discussing the new patient intake procedure. Now read the question.
We've implemented the new digital intake system, but it seems like only about 35% of the patients are using it so far.
That's quite low, especially since the system is supposed to streamline the entire process. Should we remind the staff to encourage patients to use it?
I've already sent out 2 memos and discussed it in our team huddles. It might be time to bring it up in the upcoming department-wide meeting.
The one scheduled for Tuesday morning? Do you think everyone can attend?
Most should be able to, but if someone can't make it, we can discuss it with them directly after the meeting to ensure they understand the importance.
Now look at question 29. You hear a presentation about a new approach to managing vascular dementia. Now read the question.
Thank you all for joining today. After thorough evaluation, the hospital has decided to adopt a new strategy for managing patients with vascular dementia. Traditionally, Treatment has focused on managing symptoms with medications like cholinesterase inhibitors, but these can sometimes cause side effects such as nausea and loss of appetite. The new approach emphasizes a combination of lifestyle changes, such as regular physical exercise and a healthy diet, which have been shown to improve cognitive function. While these changes require commitment and time, they are significantly beneficial in slowing the progression of the disease. Most importantly, studies have demonstrated that this approach can also reduce the risk of further strokes, which are a major cause of cognitive decline in these patients. Based on these findings, we believe this comprehensive strategy will enhance the quality of life for our patients with vascular dementia.
Now look at question 30. You hear a nurse explaining a new medication administration process. Now read the question.
Should we double-check all medication doses before giving them to patients, or is it enough to rely on the automated dispensing system?
That's an important question. Even though our new system is designed to reduce errors, it's critical that you still perform a manual double-check of all doses. We are transitioning to this technology to enhance patient safety, but there is still room for human oversight to catch potential mistakes that the system might miss. I understand this adds an extra step, but it's vital for ensuring patient safety.
So we need to manually check each dose before administration?
Yes, that's correct. Exactly. Any more questions?
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a doctor giving a detailed presentation on sedentary lifestyle. You now have 90 seconds to read questions.
Good evening. I'm Dr. Sandra Mitchell, and today I want to talk about a topic that's affecting more of us than ever before: the dangers of a sedentary lifestyle. In this discussion, I'll be sharing what we know about the risks of prolonged sitting and inactivity, and we'll also tackle some of the misinformation out there about what really counts as healthy movement. Let's start with a simple question: why does sitting matter? It seems innocent enough, right? We sit when we work, when we relax, and often when we eat. But the truth is, the best available evidence shows that a sedentary lifestyle, defined as too much sitting and too little physical activity, is a significant risk factor for many chronic diseases, including heart disease, diabetes, and even some cancers. The problem isn't just the lack of exercise, it's the extended periods of sitting itself. Even if you exercise regularly, prolonged sitting can still have harmful effects on your body. So what's the big deal with sitting? When we sit, our bodies essentially go into rest mode, slowing down our metabolism, decreasing insulin sensitivity, and reducing blood flow. In other words, sitting for too long makes it easier for our bodies to gain weight, develop high blood sugar, and accumulate unhealthy fat around our organs. Some researchers even refer to prolonged sitting as the new smoking, not because it's the same exact risk, but because it's becoming one of the biggest public health threats of our time. But why is there so much conflicting information on this? Well, part of the problem is that modern culture glorifies convenience and comfort. We've created an environment where almost everything is within reach, and we rarely have to move to get anything done. Plus, the fitness and wellness industry often promote quick fixes, like one workout a day or standing desks, as though these can fully negate the hours we spend sitting. But the reality is, it's not just about hitting the gym once a day or swapping your chair for a standing desk. It's about integrating movement into your entire day. And that's where the debate gets complicated. For example, you might see articles saying that standing desks are the solution, but standing all day comes with its own set of problems, such as varicose veins and joint pain. Or, you'll see recommendations that a 30-minute workout can cancel out a day of sitting. Unfortunately, that's not quite true. The best evidence suggests that breaking up long periods of sitting with short, frequent bouts of movement, like standing up every 30 minutes, taking short walks, or even doing light stretching, is the most effective way to counteract the negative effects of sitting. So, why do people cling to these myths? Well, just like with dietary fads, there are powerful industries and marketing forces at play. The office furniture industry, for example, has a vested interest in selling standing desks, ergonomic chairs, and other equipment marketed as health solutions. Similarly, fitness apps and gadgets often push the idea that a single exercise session can make up for a sedentary lifestyle. But it's crucial to remember that these are often profit-driven narratives, not evidence-based solutions. Look at it this way. The most compelling data we have comes from population studies, like those looking at blue zones, regions around the world where people live the longest, healthiest lives. In these areas, people don't necessarily go to the gym, but they move naturally throughout the day. They walk, garden, and perform daily chores that keep them active. The key takeaway is not necessarily the intensity of the movement, but the consistency and integration of movement into everyday life. For example, in Okinawa, Japan, one of the famous blue zones, elderly individuals are still active well into their 90 seconds because they live in environments that encourage movement. They sit on the floor, which means they naturally get up and down many times a day. This kind of natural, integrated movement is far more beneficial than simply exercising for an hour and then sitting the rest of the day. So, the message is clear. We need to rethink how we approach physical activity. It's not just about the gym or standing desks, it's about building a lifestyle that prioritizes movement in all forms.
Extract 2. Questions 37 to 42. You hear a doctor giving a presentation on medication non-adherence. Now, read the questions. You now have 90 seconds to read questions.
Hi, I'm Dr. Lisa Marlowe from the Department of Public Health at Central Medical University. Today, I want to highlight a pressing issue that's impacting patients and healthcare providers alike: the growing concern of medication non-adherence. It's a widespread problem that doesn't get enough attention, and I believe it's time to start a conversation about why patients aren't taking their medications as prescribed. So, what is medication non-adherence? It's a scenario where patients don't follow their prescribed medication regimen. This could mean they're not taking their medications at the right time, not taking the correct dose, or even not taking them at all. Non-adherence is not just about forgetting to take a pill now and then. It's a chronic issue that significantly affects patient outcomes and healthcare costs. A study published in the Annals of Internal Medicine found that 20 to 30% of medication prescriptions are never filled, and around 50% of medications for chronic diseases are not taken as prescribed. Non-adherence leads to approximately 125,000 deaths per year in the United States alone and is responsible for 10% of hospitalizations. This is a huge problem, not just for individual health, but for the healthcare system overall. It costs the US healthcare system nearly $300 billion annually. Why does this happen? Well, there are many factors. Some patients struggle with the complexity of their medication regimens, especially when they have multiple prescriptions. Others might stop taking their medications due to unpleasant side effects, or because they start to feel better and wrongly assume they no longer need the medication. Financial barriers are also a big reason. The high cost of drugs can prevent patients from filling their prescriptions consistently. Lastly, there is often a lack of communication between patients and healthcare providers, leading to misunderstandings about the importance of adhering to treatment plans. The consequences are serious. Non-adherence can worsen disease progression, lead to unnecessary complications, and significantly reduce quality of life. For example, in patients with chronic conditions like hypertension, non-adherence can lead to uncontrolled blood pressure, increasing the risk of heart attacks and strokes. For diabetic patients, it can result in poor glucose control, leading to severe complications like kidney failure or blindness. For mental health patients, not taking prescribed medications can result in relapses or worsening symptoms. Healthcare providers also suffer due to medication non-adherence. They are often left dealing with the fallout when patients fail to follow treatment plans, leading to repeated hospital visits and deteriorating health. It's frustrating for doctors to see their efforts undermined by something as preventable as non-adherence. So, what can be done? First, we need to improve patient education. Patients must understand why their medications are essential, what the side effects might be, and how to manage them. Pharmacists and healthcare providers should make it a point to educate patients on the importance of sticking to their medication schedules and how non-adherence could harm their health. Another key strategy is to simplify medication regimens. Where possible, doctors should prescribe once-daily medications or combination pills that reduce the number of medications a patient needs to take. This can make it easier for patients to remember and adhere to their prescriptions. Financial barriers also need to be addressed. Many patients struggle with the high cost of medications, so healthcare providers and policymakers should work towards making medications more affordable. This could involve negotiating better drug prices, providing subsidies, or exploring generic alternatives. Digital solutions like medication reminders via apps can also play a role. Many patients benefit from digital aids that remind them when to take their medications, keep track of their doses, and alert them when they miss a dose. Telemedicine consultations can also help by providing ongoing support and follow-ups to ensure patients are staying on track with their treatment plans. Another approach is to enhance patient-provider communication. Open conversations about medication concerns, side effects, and barriers are crucial. This dialogue can help address any fears or misconceptions patients may have about their medications. Support groups and peer mentoring programs can also provide encouragement and accountability. In the end, medication adherence isn't just a patient problem, it's a healthcare system problem that requires a multi-pronged approach. By implementing strategies to support adherence, we can help improve health outcomes, reduce hospitalizations, and save lives. We owe it to our patients to make it as easy as possible for them to follow their prescribed treatments. Medication non-adherence is preventable, and with the right strategies, we can make a significant difference. This is an area that needs more focus, more resources, and more innovation. The stakes are simply too high to ignore it any longer.
That is the end of Part C. You now have 2 minutes to check your answers.